Hi everyone, I'm Dr. Skowron, and it's allergy season. And what season is that? It's every season. Whether you have spring, summer, or fall seasonal allergies, winter allergies to dust and mold in your house, or year-round allergies to foods or pets, every day can be an allergy day. Now, we're all familiar with typical allergies. The pollen comes out and we start sneezing, or we eat a peanut or a strawberry and our face and throat starts getting itchy. Or for me personally, a cat walks on my face and I start crying. These typical allergic reactions are controlled by an antibody known as IgE. The IgE antibody releases histamine in our system and we get our typical allergic reactions. We can take over-the-counter antihistamines or vitamin C, vitamin D, and bioflavonoids to reduce those responses. But did you know there are non-typical allergic responses? We have histamine receptors in our stomach that produce stomach acid. These are called H2 receptors. And we can have reflux or GERD as an allergic reaction. We also have histamine receptors in our brain called the H4 receptor, which can cause hyperactivity or ADHD symptoms as an allergic reaction. Also, get a load of this. Certain foods have histamine in them, which means you may not be allergic to a food, but if your body is sensitive to histamine, even a food with histamine in it that you are not allergic to can cause allergic symptoms. Wow! If that's not enough, your body can respond to foods with an allergy, a sensitivity, or an intolerance. Now these are all different, so you can have one or the other, or both, or all three. Now an intolerance is when you have an inability to digest something, such as a lactose intolerance. Lactose is the sugar in milk products. If you can't digest the lactose, you end up with gas and stomach pain and bowel changes. Similar with gluten or beans or some vegetables, they make you gassy because you can't digest them, but you are not allergic to them. You may also have a sensitivity to foods, which means your body produces a non-allergic immune response that causes other non-allergic symptoms. So you may eat gluten and feel horrible and eat dairy and feel horrible, but it's due to a different antibody known as IgG. Let me give you a few examples. Celiac disease is a serious autoimmune illness which occurs when you eat gluten and your body responds with an attack on your colon. Very extreme. A gluten allergy or gluten sensitivity or an intolerance can cause symptoms that are not an autoimmune attack, but can cause other digestive or neurological or musculoskeletal problems. Many doctors will test you negative for celiac disease and assume gluten is okay for you to eat, but that may not be the case. Similar with dairy, you may be allergic to one of the proteins such as casein or alpha or beta lactoglobulin, or you may be lactose intolerant, or you may be sensitive to the milk proteins that can cause a lot of different symptoms. So, what do? Consult your naturopathic or functional medicine physician and get tested. Allergy tests, celiac tests, food sensitivity tests. These can all guide you to understand what foods or environmental factors are making you feel crappy, so you can change your lifestyle and start feeling great again. Thanks again for watching and sharing our Natty P TV videos. And I'll see you...